So today, I'm announcing that if passed, Budget 2023 would invest over $2 billion this year alone, the highest ever in Alberta's history, to improve primary health care. If you look at the next 3 years, we will have more than $240 million in new funding. This would include $125 million to implement recommendations coming from these MAPS panels, and I'll talk about that more in a moment. $40 million to support primary care networks, which follows through on our commitment made in the AMA deal signed last fall, and $27 million to PCNs to provide for an expected increase of patients attached to a primary care provider. In addition, there is $12 million to help community-based physicians with IT systems that will help enhance continuity of care for patients. Now, last week, the Indigenous and Strategic Advisory Panels presented me with interim reports that identified several opportunities for early investment in the primary care system, and I accepted them all in principle. The panels presented these opportunities because they felt they were too important to delay their implementation until their final reports are presented this spring. These strategic investments will begin to address some of the long-standing challenges people face when trying to access primary health care.
Today's announcement represents a significant investment in Alberta, in the healthcare that Alberta needs, and is an important step in reorienting our health system around primary health care. Efforts to improve access to primary health care for all Albertans will improve health outcomes for all Albertans.
Primary care networks, or investment in primary care, has been shown by data to actually help people live longer, healthier, and actually keep out of the hospital system, which costs all of us more. So actually, the primary care network as the tool to increase primary care investment is definitely the right model, and there's scope for growth. There's definitely more potential untapped within PCNs. So I'm looking forward to the future and the work coming out of MAPS to move that forward.
So the panel holds immense responsibility and plays an important role in identifying meaningful and practical recommendations to ensure that Indigenous people have access to high-quality, culturally safe primary healthcare services, no matter where they live in Alberta. The panel is confident that the implementation of these first 5 recommendations as part of the modernization of Alberta primary healthcare system will bring meaningful changes to health of Indigenous people. And as the CEO of Siksika Health Services and a Siksika Nation member myself, I know the right solutions come from within the community.